Air New Zealand is being criticised by its own staff for not making masks mandatory for passengers. The country's latest community COVID-19 case was a Defence Force worker who took a domestic flight to Wellington after becoming infected in Auckland. Meanwhile, Prime Minister Jacinda Ardern and Director General of Health, Dr Ashley Bloomfield, appear to be at odds over whether people should mask up on planes, trains and buses. Nick Truebridge has the story.
The risk is real. There's nothing stopping those unknowingly infected with COVID-19 boarding domestic flights. That's what the country's latest community case did when they caught an Air New Zealand flight from Auckland to Wellington last week. Those sitting near the sick Defence Force worker have been tested and are self-isolating. Their household contacts also told to isolate until the passengers received a negative result. So what's Air New Zealand doing to keep its customers safe? Internal sources tell Checkpoint the answer to that question is not enough. One staff member whose comments have been voiced to protect their identity points specifically to Air New Zealand's leniency on mask use. At level 1, masks aren't required on domestic flights and aren't compulsory on international flights.
Other airlines can manage it. On other airlines, masks are a condition of carriage.
Conditions of carriage include things like wearing footwear while boarding, leaving the employee puzzled face coverings aren't on the list.
So it can be done. And like I said, other airlines are quite happy to mandate mask use.
Checkpoint's Air New Zealand source says both union officials and the airline's health and safety team have raised the issue of passengers not wearing masks.
I really do not know why it hasn't been implemented. There's probably a couple of reasons at play. It doesn't want to come across as heavy-handed to its passengers. It's very image-conscious. Also, Air New Zealand has a habit of not being leading anymore. They're more reactive and they'll leave things until the last minute. They'll leave things as long as they can, basically. And that's what we noticed in the early months of the COVID outbreak and when our crew were getting COVID and it was just a bloody mess. We had more than 30 crew catch it, and they're the only ones we know about.
But Air New Zealand says masks are freely available on domestic flights and passengers can wear their own face coverings. In a statement, Chief Medical Officer Dr Ben Johnston says crew must wear masks on flights carrying passengers who haven't undergone managed isolation and quarantine. He says the airline's mask policies reviewed regularly and studies show the risk of transmission between customers or to cabin crew is very low because seats face forward, seatbacks provide a barrier, airflow within the cabin is high and the direction of airflow on board is from ceiling to floor. Dr Johnston says the only question regarding masks in recent months has been by employees about discomfort and skin irritation related to prolonged use. The most recent meeting with senior union reps was on November 6 and Johnston says no representative raised questions about masks. Meanwhile, Prime Minister Jacinda Ardern and Director General of Health Dr Ashley Bloomfield appear to be at odds over making masks compulsory on public transport at level 1. Dr Bloomfield told Checkpoint he's been consistent in his advice that masks should be compulsory.
There is a huge amount of advice I've given the government that they have taken up. At this point, their decision is not to make masks compulsory under Alert Level 1, but they did accept our advice about doing it under Alert Level 2, so that's very much a part of that Alert Level 2 framework. At the moment, I'm continuing to strongly encourage people to use masks on flights and public transport.
But the Prime Minister says she's never received such advice.
I haven't received any written advice on that. It may have been a verbal recommendation to a minister. Again, if he wishes to put that to Cabinet, he is always, of course, free to bring those recommendations through.
Ms Ardern was asked if the defence worker case was reason to consider making masks on public transport, including flights, compulsory at level 1.
That was a reason for people to always continue to use them. Of course, at level 1, we do consider the risk level there to be at a different place than we do at the other alert levels, which is why we don't have the order in place. But again, can I be absolutely clear? I wear a mask on a plane. I encourage others to wear masks on a plane. I encourage people to use them on buses, places where you have close contact with people that you don't know. I would absolutely, in those environments, encourage mask use, regardless of whether there is an order to compel you to.
People on the streets of Auckland this morning were keen to see fellow commuters masking up.
I know I'm doing what I need to do for me, and I wear it out in the street as well, especially in Auckland City.
But it's funny, I should have brought one because I felt like I should have when I was on the bus in Auckland today. I thought, maybe it's time to start wearing a mask again. Everyone's got a bit, slack.
Yeah, well, I thought we were supposed to, so that's why I did it. And because I'm a little bit older, I thought it's important on transport, yeah.
I think people should have to wear masks. I don't think it's a hassle and it's good for the greater good.
I think everyone should wear a mask, on flights and stuff.
So while the Prime Minister is hesitant to issue a declaration, it's clear the country's top medical man and some members of the public want masks made mandatory on public transport to stop the spread. For Checkpoint, Nick Truebridge.